that is one of the problems, because you get the medicine, but you are not told, yeah, you are feeding the beast with what you are eating. So it becomes bigger. Yeah. Remember I told you that it started with my thumb.
Yes.
But I was on medication, but it was spreading. I didn't know that. So it was putting me down. Yes. Yes. Let me tell you, when I was about 58,
yes,
there's a verse in the book of Timothy which says, physical exercises is of some value.
Hey, preach for us,
yeah? God. So now, as a believer, yes, I wanted to know, what are these physical benefits? What are these values that I can get? So that opened my mind, because actually, you know, these things, Emily, we know them.
We know them.
But doing is where the problem is.
It's hard. It's not easy to do.
Yeah? So I started doing exercises. Of course, I couldn't do much. It was little struggle. I would start with 5 minutes and, you know, I'm tired, almost breathless.
Something I've not asked, how was your weight by then?
My weight, I can say that, of course, much heavier, because I can't wear what I was wearing then.
How much did you lose?
I was, I think, right now I'm about, I am actually 67 kgs. Yes.
Down from?
About 80.
Well, that was good weight.
So it's a journey. It's a journey. Yeah.
It's a journey.
Like we say, Rome was not built in a day.
You did exercise, and were you going for checkups by then? You were taking on this kind of diet, you were taking on drugs, you were doing exercise, you were still going for checkup? I
continued with the blood pressure medication.
Yes.
I think the one I dropped first was the arthritis one. Because if I'm not in pain,
why are you taking?
Why go to see a doctor then?
Or you just dropped on your own?
I just dropped on my own, that one. I did have the pain. And now I can move. You see, before I couldn't fold this finger like this. Yeah? Now I found I'm washing. I'm able to touch cold water. I'm sleeping okay at night. Did I have a need to go and see a doctor?
Doctor loses business.
Yes. So I stopped that one. That's the first one I stopped. For blood pressure, I continued. But with the time, I bought a monitor. So I would now take my own pressure. Yes. As I was working with the doctor. So I worked with the doctor, where now I was taking a tablet yesterday initially. Then after that, we started skipping one day, taking half a tablet, you know, like that. Until now, no. Although they tell me that it's good to always monitor, because yeah, so I do monitor, and yeah, I'm careful. I still work with the doctor, but I'm not on medication. Yes.
And how long? That is again at 58 when you stopped taking medication for hypertension?
Yeah, around that time.
So then from there you just continued with that diet?
And exercises.
And exercises, yeah.
Yeah, you know, Emily, exercising. This time now, I have discovered it's one capsule heal all. There is no disease it can't help you get over. Why? We have talked about making the body alkaline. When we work out, we breathe heavily. So you are taking in a lot of oxygen, and oxygen is alkaline.
Yes.
So it will go to do the healing.
Yes.
The organs of the body become stronger.
Yes. From
the bones,
yes,
to the organs,
to
the
lungs,
heart,
yeah,
as you are breathing, the lungs, you know, so they are working better. The circulation system is opening up.
Yes.
The arteries, the veins, they are opening up.
True.
So circulation is much better.
Yes.
So healing takes place.
Yes.
The Bible says that life is in the blood.
That's
Leviticus 17:4.
Yeah, life is in the blood.
So when you take this blood throughout the organs, it will work on all the diseases. So, and let me tell you,
Yes.
yeah, because there are so many other things. You know, as you grow older, there are so many challenges with sicknesses, different ones.
Yes.
Some of them, actually, you get to believe that it's like you have to have them because you are old.
Yeah.
But
Yeah.
that is not so. Let me tell you another thing that has happened in my life.
Yes.
I was using glasses
Mm-hmm.
to read.
Mm.
Today, I don't.
Yes.
So out of what I have been taking, yeah,
And what you've
the
been doing.
diet and what I have been doing, the diet has worked. I didn't know when it worked, but I know this day. If I take a book, I don't need glasses. Although that time I had 2 pairs. 2 pairs because you don't
case
want
you
to
lose.
forget
In case you lose one.
or go to the supermarket, you won't read the prices there. So you are there. No, these days I don't. I have them in the house, but I don't use them.
After working the eye unit, I knew that it's called presbyopia. It's a condition you must have when you hit 40.
I was told when you get that age, your cornea becomes tough, so everybody starts losing. But I have regained my, or
Sight.
improved, I don't know,
Yes.
because maybe I'm not like a 20-year-old.
Yes.
But one thing I know is that I'm not using glasses. And that has come about in my 60s now.
Imagine.
Yeah. So I always say, how much more would it have been had I known what I know today? I would never have known that there are glasses to be worn. Yeah. I would never have known that there is arthritis to be treated, and it is a painful disease.
It is.
Or there is blood pressure.
Yeah.
And I'll tell you another one. I recently, I think about, I had what we call, I saw the doctors, you know, I had some pain in the head, which used to come like that, and it is gone, you know. It can stay for about 3 days, then like that, you know. So I started consulting about it. Of course, spending a lot of money. Consultation is 5,000. You go for MRI,
It is.
16,000. Then the medication I was given, because they discovered whatever they discovered, 6 different medicines. So I was putting them there and swallow. It's like I'm eating. And they didn't work. You know, they didn't work.
It's like you're eating food.
Like I'm eating.
Are we laughing from
So, but let me tell you,
Yes.
I through my interest now,
Yes.
and of course, because I was told they are called head cramps. That's why even NHIF,
Cannot pay for head cramps.
yeah, I don't know what the head cramps. I don't know. Yeah.
Okay.
Now, that's why the hospital, whatever, they could pay now for me. NHIF could now pay for
Because
me
it's
because
head
it's an
cramps.
emergency, you know.
Oh, yeah.
Yeah, it's an emergency. So whatever they discovered is about excessive mucus. So it was blocking,
Blocking the nostrils
yes. So,
and bringing head cramps?
kwa sababu there was something that was blocked
Oh,
on one side.
okay.
Yeah. So I was given those sprays.
And it was not sinusitis? Okay.
No, anyway, I don't know.
Even me, I don't
We
know. I don't know. I'm
listen, you are
discussing
told
it.
it is this and you obey.
You know, I'm
Si
discussing it
unajua
and I wasn't the
kama
doctor.
hakuna, if there is something that you learn,
Yes.
you don't doubt doctors. You go with them all the way. Yes, it is.
That's so funny. You
So-
don't tell the doctor, I know.
Yeah, I know. So I also took about 6 different medications. Then the spray, nothing. It would improve for a short time. And let me tell you, I decided I'll go herbal.
How did you know
That's
about
a
herbal?
recent one.
How did you know about herbal?
I heard that there is some people, there's a trust, they call themselves Trust for Indigenous and Cultural Medicine, something like that. So they teach people at the museum. I enrolled for that class. where we have people, we are taught by a teacher about those herbs. And by the way, they are just what we have around treating different people.
Are these Kenyan teachers?
Yeah? Yes,
Okay.
they are Africans.
Okay.
And those people who treat people with the herbs, I don't want to say herbalists because we have a very bad connotation about herbalists. But let me tell you, I wish we would change our attitude. Because even the other medicines, most of them are made from herbs. Only that zinaongezwa, maybe they add chemicals or whatever, add the dosages and the whatevers, but they affect other organs.
Yes.
So now I have learned herbs will not affect other organs. Whatever comes, whatever you are given to eat naturally, will not harm the body.
It won't harm the kidney. It doesn't have
not the liver, not the whatever. So I enrolled in that class. I go for it every week, once a week. And when I'm there, I do identify the people with the different, you know, the best of who are there.
The best herbalists.
So I got hold of one after the class. Yes. I asked him, what can I do about such and such a condition? Yes. So he gave me a remedy. Let me tell you, Emily, what he told me to do. In fact, he just told me, hiyo ni kitu kidogo. So he told me what to do. When I came and did what he told me to do, just a few drops, I didn't leave the sink. Ask me what was I doing in the sink.
See, that's what I want to hear.
Whatever was stuck there, I think, I don't know for how long, because whatever was coming out, you know now the accumulation of mucus, even for a long time, because some green, black, I don't know.
Why was it accumulating?
Tell me, I don't know. Overproduction. They say that there is a bacteria that does that. So not all of it comes out. So this is what blocks the inside.
So the medication was?
It did not work. For me, it was very, very, very temporary relief. In fact, I was supposed to be going, I don't know for what, some other things. I still have the prescriptions to go, I don't know, and have what done. But I don't have the problem now.
Problem what?
So herbs, the natural remedies, the natural food that God gave us, exercising, yes. Move, because like we say, if you don't use it, you lose it.
You lose it.
Yeah?
Yes, it's true.
So that's why I do exercises, and the benefits are enormous. From good sleep to nice mood. You know, when I had those diseases, especially arthritis,
you were very moody.
I was moody because you are in pain. I was moody because when we meet as women in the gatherings, even family gatherings, I can't wash the dishes. Oh. So they'll be thinking,
you are feeling
it's
yourself,
a show off.
a show
you know.
Off.
Yeah? I'm able to manage my own life. Emily, that time I was not even able to do my own washing. Even the smallest articles of clothing, I was putting it down, stepping on it, and I wash with one hand. You see, even bathing it's difficult because now this hand will not agree to work. It will not cooperate. So
like the pain was consistently present, even with medication.
It was, even if it eases, it's just for a short while. Not that you are not feeling anything, but I call it management, but not total management.
Yeah, it's not going away.
Yes.
It's sitting down with you. Like you need to know how to correlate. And
some things you can't, some ligaments you can't use. Like I have told you, this finger I wouldn't do like that. So how am I going to wash dishes when the fingers are like this?
Wow.
Yes.
So currently what you are doing is learning this herbal and how they work, and to see how you can share out information about working out and getting treatment using the herbal medicine that you've identified.
Yes, Emily, I'm very, very passionate about it. I want to talk to the young people.
Please talk. Talk to them.
I want to talk to you, young people,
Yes, including me.
that you should know and value your life. And so do what you know will help you. Whatever the world teaches you that it is good for you, the food, refined foods, yeah, the instant foods, you know, they are poison in your bodies. You are feeding diseases. And your health is your wealth. So the earlier you get started, the better. I started late in life after suffering. But I'm here to talk to you today so that you learn from me, do what you are supposed to do, and keep off diseases. Enjoy your life. Flourish even in old age. Diseases are not natural things. We bring them upon ourselves. And to the old people also, it is doable. We are able to address our bodies. Our bodies are able to heal themselves if we do the right things. God made us to feel the pain so that you know that there is a problem, you work on it. Feed properly, exercise, and it doesn't matter where you start. Start with 5 minutes exercising. Increase, everybody walks their journey. If you look at me now and what I do, you would think I have always been doing it. But no, I started somewhere. What do we need to be able to manage ourselves? Something we call discipline. The difference between success and failure is action. You have the knowledge and also continue seeking, then act. The word of God, I think in Hebrews 12:11 tells us, no discipline seems pleasant at the time, but painful. But however, later on, it produces a harvest of righteousness to those who do it. So once you do it, there is a harvest.
Sure.
And the harvest that you want is good health. Yeah? It is to flourish even in old age. So that's why I like talking to people about it. I have a passion. And that is why I started a YouTube channel.
Yes.
To talk about total body wellness, body, mind, and spirit.
Whatever Eunice has spoken is so loud. The disease burden caused by non-communicable diseases is rising up every single day when you look at the data from the WHO and from the Ministry of Health in this country. These diseases, as you can hear, are caused by lifestyle and what we put into our bodies. These are called that if you love yourself, if we love ourselves, are we able to put up with these things? Exercise, eat well, and in case you are unwell, seek help from the right people. That's all I can say. So if today, Eunice, you are given a platform in the country regarding health, what will you be focusing on?
A platform in the country?
Yes.
I would talk about, I would work with people concerning good health, totally, mentally, physically, and even spiritually. Because you cannot separate those. You cannot separate them. I always say it's like there are three, we used to have the three-legged stool. Maybe you didn't get it.
I did.
It can't hold with the two.
No, it can't.
So we are we are balanced. So I would work with people, talking about my journey, what caused the experiences that I had, how I corrected it, and how to avoid good health. Because whether it is physically, mentally, what we put in is what it destroys or builds. So we have a choice. So that's what I would inform people to do.
I get it. So any, from the nutshell, from Health Focus platform, we've had any chronic condition can be reversed. That's all I can hear. We are yet to get somebody to talk about diabetes. We are yet to get somebody to tell us about all other conditions. They can be reversed. It's not too late. that's all we have from Health Focus this week. And I would say let's meet again next time. May you have a blessed week ahead.